What do indeterminate, rapid TB test results mean? Imagine getting a TB test and seeing an unclear result that leaves you wondering what it really says. That's what an indeterminate result on a rapid tuberculosis test means. When it comes to advanced diagnostics like blood tests, especially interferon-gamma releases assays, or IGRAs, an indeterminate outcome doesn't confirm or rule out infection. Instead, it shows that the test couldn't produce a clear answer. In tests like the QuantiFERON-TB Gold or T-SPOT.TB, an indeterminate result can happen for various reasons. For example, in the T-SPOT.TB test, if the positive control shows too few spots, it suggests the immune system didn't respond as expected. Or if the negative control shows too many spots, it indicates a high background response, making the test unreliable. Similarly, in the QuantiFERON test, if the positive control doesn't produce a sufficient response, the test cannot be validated. These results can be caused by technical issues, such as problems with blood sample handling or processing. Biological factors also play a role. If someone has a weakened immune system, perhaps due to HIV, certain medications, or recent vaccinations, their immune response might be insufficient to produce a clear result. Sometimes, the reason for an indeterminate result remains unknown, especially if the person's health status is stable and no obvious cause is identified. It's important to understand that an indeterminate result isn't a diagnosis. It neither confirms nor excludes TB infection or disease. If you receive such a result, your healthcare provider will review your symptoms, medical history, and possible TB exposure. They might suggest repeating the test or using other diagnostic tools. These could include a tuberculin skin test, chest X-ray, sputum tests for bacteria, or molecular tests like the expert MTB-RIF assay, which can detect TB bacteria and assess drug resistance. In some cases, especially with molecular tests, an indeterminate result might mean the test couldn't determine if the bacteria are resistant to rifampin, a key TB drug. This signals the need for further testing to guide treatment options. If you or someone you know gets an indeterminate TB test, don't panic. The next step usually involves additional testing and clinical assessment. Your healthcare provider will consider all factors to make the most accurate diagnosis. Remember, no single test is perfect, and sometimes results are unclear. That's why doctors relying on a combination of tests and their clinical judgment. In summary, an indeterminate rapid TB test result means the test couldn't reliably tell if TB infection is present. It's a sign that further evaluation is needed, not a definitive answer. Always follow up with your healthcare provider to ensure you get the most accurate diagnosis and appropriate care. If you have concerns about TB or your test results, seeking professional medical advice is essential for personalized and safe health management.